I don't get the feeling that you have much opportunity to exchange information or conversation, so I'm going to depend upon you. If you had a good point, I'll stop you if you're going too long, but I want to know what you are thinking, not what I think I want you to say. So we'll start. I'll start out by saying, are you, in whatever program you're in, where you want to be at this time and process moving toward the Obamacare, actually going into action? Who feels they are where they want to be, or that the road is not yet clear?
We only have one person who actually admits to reading the 2,300-page bill, and she's sitting over there. So you should
I read the whole thing.
You read the whole thing. I know it puts you to sleep too, right?
I scanned it. Where are we in this bill? Where are we? I think I'm definitely where I want to be, advocating for us every day. I get to go home to my daughter and say, I fought for you today, I fought for my family today, I fought for my community today. We are often the only people at the table that represents communities of color. So we have to always say, hey, what about us, all the time, and our voice is getting larger. And it's critical. I mean, there's going to be, with Obamacare, with the Affordable Care Act, just the Medi-Cal expansion is what I would like to focus, because it is low-income communities of color primarily. 1.4 million are going to come into care January 1st, brand new, never had access to care before. 950,000 of them are us, communities of color. That is 67% of the newly eligible insured. We have to make sure that that healthcare system reflects our needs. You know, recognizes that we have huge health disparities that are not addressed. And it's not necessarily the fact that we get asthma more or we get diabetes more, it's that we don't have the treatment. We don't have the access to those services. We're disproportionately impacted by a lack of access in our communities. So it's critical that we're at the table and we're making sure that we create as much access as possible.
A lot of people ask me at screenings, one of the most popular questions is, how is the Affordable Care Act going to impact what we just saw, the people that we just saw on the screen? And I don't know what to tell them. I'm not a health care policy expert. You know, I did go to journalism school, so we tried to do our due diligence to understand the healthcare law, and the more we learned, the less we knew. And so I'm just maybe, how is the Affordable Health Care Act going to impact places like the waiting room at Highland and SF General and the people that are seeking access to care?
I think a big part of the Affordable Care Act is establishing a medical home. A lot of the people who were there in the film did not have a medical home. They didn't know who to talk to, and importantly, who to trust in terms of really giving them comprehensive care and showing empathy. And I think a big part of the Affordable Care Act is, one, establishing a medical home, but then even patients who go from one insurance to the other, if there's more communication between health insurance and locations, health clinics, then it will be seamless to that patient. So if someone is seen one place and there's an issue and they can't be seen there, as was shown in the film, that there will be a handoff. And I think what that also does is it shows the community that there is trust, that the care of that particular person is more important than, you know, who is seeing the person or you know, who's getting what benefits on an organizational point. So how can we make sure we're taking care of the whole person? How can we make sure that patients know where to go appropriately and educate the community as far as what is an actual emergency, what can be handled in their medical home, and then it'll take some of the load off of the emergency rooms and give people more appropriate care.
If I could add just for a moment, I agree with the notion of having a solid medical home, and I do think that is necessary and what we should be focusing on. But I believe we have to not lose sight on the prevention and wellness part of this, because on many levels, I believe many of the diseases we're suffering from are preventable. And we have got to monitor the Affordable Care Act to make sure there are adequate dollars for prevention and wellness services. You know, we've got to do that. We've got to do that.
I might say, when I went to a conference last month where heard many speakers from Health and Human Services, and I think that those goals are embedded in the Affordable Care Act, but I think the advocacy part of making sure that that actually comes through is what the important part is.
Absolutely. You know, one of the wonderful things about the Affordable Care Act is they created a prevention fund, billions of dollars specific to prevention, getting our community-based organizations to lift up the work they're already doing, a lot of what you're already doing to get people healthy and just aware of what they can do themselves and that personal responsibility. to be healthy and do the right thing and have access to those. Unfortunately, those dollars aren't really there. You know, it's kind of like, this is a thought, this is the money we want to put into this fund, but it's not allocated, right? The budget process hasn't given those dollars. And unfortunately, at a federal level and at a state level, county level, every level, we're hurting for money. So those dollars that aren't really there, but they are allocated for prevention, are being shifted to other programs, and they're thinking of them as a slush fund. We recently heard that can be fill in other things, which we need money everywhere, but that it takes from the importance of prevention. So we have a lot of advocacy to keep those dollars there.
What happens is, because they don't get help early on, I see them when they have advanced cancers of the colon, other big sarcomas, other kind of cancers where I try to operate on them and save their lives, but because they present to me so late, right, I'm not able to do that. So what I'm hoping is part of screening, medical homes, making sure people have primary care, because before they get to me, they have to go to their primary care doctor and make sure that their whole health is okay, because that's really important, making sure that the heart, the lungs, the kidneys, everything else is okay, that they have someone who's looking after all these things, so that when they get to me, when I have to operate on them, that they're the strongest they could be, so they could survive the operation that they need to have. So we have, you know, we're a full-service hospital we're at, and right now we take care of 100,000 people in the city and county of San Francisco, including all the clinics which some of you work at, and the main hospital building which you see there. And what we try to do is make sure that folks with Healthy San Francisco, certainly, that folks have a medical home to go to. It's not an insurance plan, but it is a place where they have a home to go to, where they can go and get seen, they can be seen. So I asked the question that is asked in the movie, like, you know, who's your doctor? They said, well, I don't have a doctor. I said, well, you know, you're kind of, you know, you're 60 years old, you need to have a doctor. Someone has to look out for you also. So you try to make sure you educate folks, you know, prior to any intervention in the surgical arena, to make sure that they know that, yes, they may need to have surgery, but really it's all about their total care first, because they need to be healthy as a person before we can even begin to operate on them and take care of the problems that they have surgically. So that side is something that is really important. So I agree certainly with the concept about preventive medicine. I hope that the funds do not get tapped, you know, on the federal level to do that. But, you know, we have folks who are here locally who are in charge. We have
I'll just chip in to say that maybe our two policymakers here can talk about whether people in San Francisco have even thought about this business of needing a medical home, and that it could make a difference in how health care is
I'd like to
delivered.
comment on that. If you
Please do, and I can
Yes,
ask the supervisor if she is aware of anything. Go ahead, please.
Well, primary care is the heart of, if you will, the Affordable Care Act. And so, as a member of the San Francisco Health Commission, one of our jobs is to really take a look at how we're delivering care. And so I think one of the things that we will see is a more integrated care delivery system, so that people don't get lost through the cracks. And that's one of the things we saw in your film, of course. That will include some of the infrastructure things that we think about in terms of information technology, medical records, medical record keeping, metrics. Are we really determining whether or not there is a wellness program and what's the impact of that? So I think that, you know, everyone's involved right now in the healthcare system is challenged, I think, to really do a better job at taking care of people, and that's the bottom line. And so I think we're going to see a lot more care given to how care is delivered, where people go in the system, what happens to them in the system, and whether or not they actually do become well. I think that that's the key.
I would like to also say that within the health department, we have our community-based primary care clinics, and we have our behavioral health clinics. And we've been working for over 5 years now in terms of the integrated service delivery model, because many of the folks that you see in the film are the folks that we see here in San Francisco. They have co-occurring mental health and drug addiction issues, along with chronic complex primary care issues. So we've been working around that integrative model to ensure that wherever you come into our system, whether it's through mental health, substance abuse, that you have a medical home. And that is something that through our integrative care model, we've been working diligently and preparing to how we can respond to Affordable Care Act implementation. So that is a driver, and we are working ever so faithfully with the hospitals and our community-based primary care clinics to ensure that we have a pathway and a very clear linkage with our behavioral health system, with our housing and urban health, child maternal health, wherever you are touched in our health department, that there's a pathway for you to have a medical home, and that's where we are with the health department.
Also, I just wanted to add, not only do we have that an integrated health system, but we also have a system that's culturally competent. So there are people that are speaking different languages and reaching out in that same way, much like, was it BJ who was the...
CJ. And Rika, who she was born, and this is a really important point because, CJ was born at Highland. Rika, the social worker who was working with the drug addict, she was born at Highland. And that can't be taught, but it also sort of filters down. And at a moment when we're going to have, from what I understand, is going to be a pretty severe shortage of primary care physicians moving into the implementation of the ACA. We're not going to be able to ramp up quick enough with physicians, so a lot of the physician assistants and nurse practitioners are going to be carrying more of that burden, and we can ramp up quicker with them. And so we're going to be using the film to try to inspire these people from within our communities to go into healthcare because they have that cultural competency. That's hard. It's hard to just pick that up overnight if you're a resident like Doug coming from, Stanford or whatever into a place like Highland.
Right, one more thing, thank you. Because I just wanted to you can't overemphasize the need for cultural competency, right? That voice just nudgingly and say, okay, calm down. Also, there's a couple things. The mayor's budget was just released on Friday, and we're talking about a $7.9 billion budget. And in this budget, there's provisions that are made through the Department of Public Health to hire 300 new additional staff persons to help with the implementation of this, of what is affectionately known as Obamacare on the San Francisco County level. So when you're talking about cultural competency, we also need people to be filling the pipeline. We need nurses, we need CNAs, we need people to be going to medical school. Dr. Campbell is fantastic, but I don't think you found the Fountain of Youth, have you? No. Right. So we need to.
I'm trying to teach people behind me.
Okay.
Right, so that when I see Doug and I see the rest of them, I said, yes, the future is going to be bright because they're so talented.
And we need more. We need more of this talent. So when we're talking about, we need to continue to talk about filling the pipeline so that there is a continuum of advocates as well as healthcare providers.
Okay, we're going to get to you, Dr. Cameron, in just a minute about the new direction in training, if that's what's going to have to happen. But I want to talk to people who are trying to prevent people from ending up at Kaiser or at the health center that is the closest thing to the place you don't want to be, as Alameda County's Highland was in this film. So Perry, why don't you and Andrea tell us about the programs that you're working on?
Sure. This is my passion, so bear with me, and I won't go too long. But prevention and wellness, it is just the key from my perspective. It is wonderful to take care of people when they're sick. That is a blessing, it is a great thing. But if we can do something before that happens, it's better. One of the things that I think we've got to do as we monitor the Affordable Care Act is look at the dollars to see whether and how much is going to wellness. And my concern is not enough. I think the other thing we've got to do is develop a better partnership with the hospitals and the clinics and the wellness centers in the community. I think we should have reasonable referrals so that if someone comes to the hospital and they have diabetes, they can also be referred to the community clinic or the community wellness center where we're offering reflexology, where we're massaging people's feet to look at their diabetic conditions on some level, where we're teaching them what to eat to better their condition. I think there are links that we're not making that we really should. I think in terms of the pipeline, making sure that we engage our youngsters with us as we're working and doing our wellness activities, as we're talking about health policy issues. We have a council that we work with. We invite young people to come to those meetings. One youngster that worked as a volunteer with us is going to medical school now. His parents aren't thrilled because he took the first year off to spend some time in Haiti, just working there. But I think we can open our doors in such a way that we can invite young people in to help them think anew about careers in the medical field. And I also think we can do a better job of making sure wellness and prevention is linked and referred to in some kind of way with hospitals and clinics.
Andre, move to those programs. I know there are a lot of HEAL, I think, are the initials. Just a quick bit about that.
In the Bayview community, what I've been learning more and more is that many of the churches, many of the schools, many organizations already have an interest and love of promoting health and healthy eating and active living. And so in a lot of ways, a lot of the organizations in the Bayview are struggling for resources and having it, and so part of the Heal Zone work is to bring organizations together and churches and schools, and to figure out how we can leverage funds together and how we can all work together to be able to serve our communities better. So, I think that's a big part of what the work needs to be on the ground.
I know that you want to get in on this one because that's the foundation of the Kaiser plan is prevent.
The Heal Zone here in Bayview is the 7th Heal Zone that Kaiser has sponsored in Northern California that's focused on a specific population with known disparities and looking at how to really let the community take charge of what changes need to be done. In this instance, the grantee was Department of Public Health that's been running the Heal Zone, and Andrea's been focused on actually implementing the Heal Zone, coordinating care for the whole community, looking at how to develop safer streets, looking at how to work with schools, how to educate, working with the YMCA and many different other community partners. And I think that's really the big learnings from what I have done working at Kaiser is, as they both have just said, there are limited resources, and the more that we can work together as different organizations, so we're not duplicating, so we're not working in silos, and really finding how can we have more effective partnerships, I think that's really the key. My co-worker Mark Gaines over here and I have worked with Caring for Your Family's Health workshops in the community with many churches here in the Bayview, and I think having that as an educational tool has been fabulous. Looking for ways to really raise awareness. As a physician working in clinic all day, certainly 20 minutes of my time in trying to convince patients to eat properly, exercise, etc., can't balance out with going home and, either having, a good home-cooked meal that may not really be very healthy, or celebrations that may include way too much cake and alcohol, or etc. So it's just what I do in 20 minutes cannot combat that. And so what happens is we really need to have a whole community that's focused on awareness of really having those discussions in the living rooms, having those discussions in churches and community centers to raise that awareness and help support each other. And what I've learned through the workshops is over a period of time, patients can really then say, oh, well, hell, let me help you. You're faced with this challenge. I can help you. I can support you in reaching your goals. And I think basically the sense of community, whether it's on an individual level with another person, whether it's with a family, whether it's a community organization, or a much larger organizations working together, I think is really the key.
Just another reminder, you should have some 3x5 cards. I haven't seen any being passed down an aisle or being collected, but we should probably move into that since that's going to be shortly. Let's go back to training.